because I didn't go into details. But my husband was in Dulles Memorial Hospital in late September. He had pulmonary fibrosis and was on oxygen 24/7. And he was there for 5 days, and we had to take him home because he just wouldn't stay. He just couldn't stay there. And I didn't go into the reason here, but I'm going to tell you now anyway. One night, with pulmonary fibrosis and the oxygen, the least effort just took his breath away. He just couldn't breathe. And so I was up there, and it was 7:15, and he said he had to go use the commode. And so I went down to the desk and said, my husband needs help. Oh, we'll be right down. So I went back, and he said, I can't wait. He was panicking then. And so this just happened a couple of months ago. Anyway,
Marion, you have it written down. Do you want me
no, I don't have this part written down.
Oh, go ahead.
So just put it on here. And so anyway, I had to look after him, and I got him out. But the effort of getting him out of the bed and onto the commode, he was panicking and he couldn't breathe. So then I had to go and take him off. They have 2 sets of oxygen on the wall. One only goes to 5, and that's what he was on. The other goes up to 10. And I had seen the nurses do this. So I had to take him off his oxygen, get the things from the 10, find a piece of plastic and put on, and got him there. And he looked after him there. Then I got him off the commode and all cleaned up and back into the bed. And this was at 7:15, and this is all happening after that. And then when his breathing quietened down, I took him off the 10 because they can't stay on that long, and onto the other. And it was a little after 8 o'clock. No one had been down to see him. Now, if I hadn't been there to look after the oxygen, I don't think he would have lived. I honestly don't. And that was the care that he was getting. So we decided he had to come home. So we have to get this OPT to bring him home. I couldn't bring him in a taxi or anything. So that was $144 just to bring him about 2 kilometers. Then when he got home, he did phone the hospital and he talked to the head nurse. And now mind you, I don't blame the nurses because there were only 2 nurses to look after approximately 40 beds, which is impossible for them to do. But anyway, he phoned and he talked to the head nurse, and then she referred him to someone else. Anyway, that was my experience there. We got home, we went into hospice in Niagara Falls, and it was different as day and night. And I just wanted to say that the NHS has to change their thinking, that the one priority in health is the patient. It's got to be the patient. That's what health's all about, not what NHS wants and thinks, but the needs of the patient. And it's as simple as that. And the NHS and LHIN are complete failures in this. Sadly, for their failures, they are costing the taxpayers hundreds of millions of dollars, but the most important is they're costing people's lives.